Uganda and Democratic Republic of Congo will have to double their efforts to eliminate MPOX. Whereas it is now regarded a global issue with outbreaks recorded outside the Africa region, DRC, where MPOX is regarded endemic, Burundi and Uganda contributed 91% of the 25,902 cases by the 11th week of 2025. Dr. Ngashi Ngongo is the head of the Incident Management Support Team based in DRC.
When we look at week 11 itself, we've reported 3,323 cases compared to 2,711 the week before. That means that we have a 22% increase. We've seen the same increase on the number of confirmed cases, 925 against 381. But some stabilization on the number of deaths, both on the confirmed and the suspected. But what we see is that the situation remains the same, that Uganda, Burundi, and DRC account for more than 90% of all confirmed cases. That's 91% in week 11. And we are also seeing that this data confirm the sustained community transmission, in these countries that are affected. But on the case fatality rate, we are seeing a decline. Remember, when we started the year, we started with a case fatality rate of 1.8, but now that is going down to 1.5%, meaning that it is done some improvement we have seen.
In the last address about the matter, Minister for Health, Dr. Jane Ruth-Acheng, said Uganda is reinforcing the surveillance teams to comb for any alleged cases within the communities.
It is now 6 months since the country started responding to this disease outbreak. To date, 87 districts have reported at least one confirmed case of MPOX. And the total number of confirmed cases is 2,896, out of which 19 unfortunately died. The majority of the deaths were among individuals with underlying conditions such as HIV, tuberculosis, and sickle cell disease. However, allow me to report that 2,126 patients have recovered after receiving supportive treatment at Entebbe Isolation Facility and other public health facilities. The Ministry of Health, in collaboration with district authorities and partners, have been implementing the following control measures: active case search, contact tracing and monitoring, intensified public awareness and risk communication.
The Africa CDC is taking the same approach. However, this may see a spike in the number of new infections.
We are expecting a sharp increase, about 50% in the number of cases. At the same time, also with the same community intensified follow-up by community health workers, we are also pushing the contact tracing with the target of having at least 20 contacts per every confirmed case. On the laboratory side, we are now around slightly over 50% testing coverage. We want to push that to 80%. And the genomic sequencing also, we are targeting 8% of confirmed cases that have to be sequenced to be able to track the mutations, I think, that are happening with the MPOX, as we just reported last time on the Apobactria. On vaccination, I think the target is to cover at least 80% of the target group in every country, and we estimated that in total we'll need to vaccinate about 6.4 million people during the next 6 months of this second plan. And on the case management, we target at least 80% of confirmed cases that need to be taken care of, considering that at least 60% of those have to be in the health facilities.
Dr. Ngongo explains that the Africa CDC now has a three-pronged goal and strategy for the next 6 months to stop human-to-human transmission, especially
in the countries that are endemic. It is to reduce by half the burden of MPOX in those countries, and in all countries, it to ensure that the system is strengthened for resilience as part of the epidemic or pandemic preparedness and response in all countries that are concerned here.
However, they are challenged by insufficient resources.
Total budget estimated is 429 million. I think that is about a third decrease from the 599 million that we budgeted for the first plan. And that the intensification will take about 80% of that budget. And then the legacy, which is the health system strengthening, will take about 20% of the budget. But also most important is that we have increased the funding for surveillance. That now takes about a quarter of the budget, and also vaccination and logistics that take another quarter. Those two pillars alone take about 50% of the entire budget of this second plan.
Nonetheless, the plan is to devise means for alternative funding and support, according to Dr. Ngongo.
We had started this discussion about innovative financing 2 years ago. Now, with what is happening, it just helps us accelerate that discussion. It is critical that we find our own funding streams, I think, that are locally made, that are not dependent on the decision of partners, but that make kind of the contribution of the Africans themselves to advancing public health. But how do we then also ensure that with our own resources, if we can clean up our own inefficiencies, we can secure as much funding as possible? That's the reason why we are working with President Kagame, because Rwanda has got a very good experience in the area, that we can also have that kind of support and engagement from the other leaders to do that.
With 1,724 deaths recorded in Africa, the case fatality rate for MPOX is now rated at 1.5%. Case fatality rate measures the severity of the disease by defining the total number of deaths as a proportion of reported cases at a specific time. Walter Mwesigye, NTV.